right, hey, Dr. Josh Plutzinger coming to you from the basement gym here in St. Charles. I have my clinic in here. This is my treatment room back here. Just like everybody else, I'm prone to injuries. You know, I'm running it hard this summer, working a lot on the house, getting after my new exercise regimens in here. So I am not without incurring back and shoulder problems, which is probably one of the biggest things that I treat. So today, I thought it would be a good idea to start showing you some of the core exercise, some of the rehab that I do on my own to make sure that I get my back in shape and that I reactivate my hips. And so when people talk about the core, when they talk about the core exercise and core muscles, I think the core means a lot of different things to a lot of different people. But when I talk about the core and I work through core exercise and rehabilitation exercise with my patients, when I talk about the core, I talk about the four movement centers, which are going to be the hips and the shoulders, and then everything in between, which is all designed to stabilize the body through movement, all right? So the hips are supposed to be mobile, and the back is supposed to be stable. When we get in trouble with back problems, it's because we're using our back in a way that it's not supposed to be used. So to reestablish proper biomechanics, I'm going to show you I'll do 6 exercises today, 6 exercises to re-engage proper hip function. And so here we go. Now, I use a mini band. These mini bands are available. I sell these. They're $5 a piece. If you want a mini band, just PM us and we'll be happy to send you a mini band. But I'm going to use the green one so you can see it pretty well, and I'm going to go through the 6 exercises here. All right? So the first one that I'm going to do is called clamshells. So what's going to happen is you're going to put this band around. Trying not to get the cord in the way here. I'm going to put that band right around my knees like that. Next thing I'm going to do, clamshells, I'm going to lay on my side. So this is the first exercise. Now the sequence of these is super important. I've done these for a lot of years in a lot of different ways, and what has made the best sequence is what I'm going to show you. It just seems to work the best when you're activating these muscles, okay? So clamshells right here are designed to turn on the glute medius. And so we're going to lay on our side, straight back, knees bent, heels together. You can even reinforce your back by putting your hand behind your back, and you're going to open and close. Open, squeeze at the top, close. Open, squeeze, close. And so we don't want to roll back. We want to lock everything. Again, the glute medius, it only contracts about that much. So you're not going to get this huge movement out of here. And we're never looking for these big movements anyway. So we're open, close. And what we do on the left, we do on the right. And so the exercise there, the activation sequence is 10 on each side. Okay? So that's clamshell. The next one, the kids have named this. This is the butterfly. The butterfly is now doing both of these together. So I'm going to lay on my back. I'm going to bring my knees up. So I'm at 90 degrees hips, 90 degrees knees. Keep the heels together, pull the toes into the shins, okay? So it's really important to activate everything through. Relax your head, because everybody's always straining their head. You want to be back like this. So from this position, now we're just doing a clamshell in the air, or what I said that the kids call us the butterfly. So we're going to squeeze open, close, open, close. And that's going to be a set of 10, okay? Next one. This one's a push-pull. We're going to activate the deep muscles inside our frame called the psoas muscles. So this band goes around our feet. We're going to get back in this butterfly position. So 90 degree bend, 90 degree bend, and then heels, we're going to go off a little bit. Actively, I'm going to pull this knee into the shoulder, and then I'm going to push this leg towards the wall. So I'm going to pull and push like this, and I'm going to come back. Pull and push. Back. Now there's 2 ways you can do this. You can do 5-second holds. So hold this for 5 seconds and come back in. Or you can just do 10 repetitions. And you can see that I'm not alternating. I'm doing everything on the right and then everything on the left. Okay? All right, so now the secret sauce comes in. We're going to go into bridges, or what I call single leg butt lifts. So if you can execute a butt lift just fine, the progression to that is a single leg. So I'm going to drive my heel into the floor, pull the toe up so I can activate the glute, drive up, lock, come back down. Drive up, lock, come back down. Now here's what happens when you do this one. If your butt is not firing, so if you're not feeling your glute fire on that one and you cramp out your hamstring or you get all that stress into your back, that means that your glute's not firing very well. So those are the 4 exercises. The bridge is the 4th. But the secret is if that one's not firing, then we're gonna get into a tabletop position. So it's a hands and knees, a tabletop position. And I'm gonna do horse kicks and hydrants. So horse kicks are just like this. I'm gonna bend my knee, again, pulling the toe into the shin. So you gotta lock that position. And then without moving anything else in my body, I'm gonna drive up and come back down. So you can see it's not a huge motion. I'm just turning that glute on without moving anything. So that's the horse kick right there. So we do 10 on each side. And then we're gonna do what's it called, hydrants. And the hydrants are off to the side. So it's right here. And again, small movement. That's all the range I have in these old hockey hips. So I do 10 on each side. And then I'm gonna come back into here, drive, come back down, and that'll clean that up, okay? Those are my 6 basic exercises to initiate the foundations of our core, okay? So the base of our core, which is our hip, they work extremely well, and it's where I would start. It's where I start when I have to reset my core, my frame from screwing up my back. All right, I'm Dr. Josh. If you have any questions, let us know here. Give us a shout. We'll talk to you soon.